Okay, hello again, everybody. So we're going to talk about compression in this lab video. First, we're going to talk about using a compression pump, like an actual unit, and then we're going to talk about utilizing like ace bandages or some compression wraps. We'll talk a little bit about the difference between long and short stretch bandages, even though you'll probably hear um, about them in lecture, and so this will hopefully be more of a review for that. So first, we have our compression pumps. There are a couple different types or a couple different ways that we can do compression pumps, or compression with the pumps, I should say. We can have just straight, what's it called? Um, Intermittent, or we can do sequential. So intermittent means that all of the pressure is going, there's one bladder throughout the entire limb, and the pressure is going to be pretty consistent throughout the entire cuff or the entire bladder. Whereas with sequential, usually you have between 3, 4, or even 5, depending on the size of the cuff, different segments within that cuff that will fill up each individually, just kind of along the way. You'll start distal, and that one will fill up to a certain pressure, and then the next one to a certain pressure, then the next, the next, and the next. And so you get this sequential filling of pressure. And the idea is that it's, again, just creating pressure more at that distal end first, and then working its way more proximal to help push the venous flow and all that gunk that we want to get out when we're treating edema. Okay, with the cuffs, there's so the pumps are used for edema, but sometimes they're used for lymphedema, and there's kind of some controversy that surrounds that, mainly because of the fact that a lot of the studies that were done surrounding lymphedema and the use of pumps, they weren't the greatest studies, and so they weren't set up right, or they didn't have a very big N, and so they're just not the best studies to go off of as far as getting some hard evidence and basing the treatment off of that. And so primarily it's used just for edema, not necessarily lymphedema. If you get into lymphedema, then you're going to start using a lot of short stretch treatment, as well as even into an Uniboot type thing, which you guys will have learned about already in lectures. So just to show you real quick, what we have here, what we have at the school, is we've got two of these cuffs. This one is the sequential cuff. We do have another machine and another cuff that is just a straight intermittent, and it is not sequential. And so hopefully when you guys come back, we can show you how to do that and everything. But this one, you can see that there's 4 different lines that go into it. So we've got 1, 2, 3, and then a little teeny one up at the top here. And this specific cuff is more for upper extremity. However, if somebody's small enough, then you could slide this onto their lower extremity. We do have a lower extremity cuff at the school, and it's got a little zipper on the side, and so you slide it on, you zip it up. But for this one, we're going to use this guy. And then we've got our machine here, which on the side, right there, is our little on-off switch. Dink! So now we've turned it on, our little thing lights up. I'm going to get as close as I can without unplugging from the wall, and that's about it. So for this one, right now, it's on the readout, it just says how many millimeters of mercury, so how much pressure we have running through the lines and things. Right now it's at 0 because we don't have anything set up, obviously. To set those, however, there's a little blue button right in the middle here, and it says mode. If you hold that down for like 5 seconds till it beeped, then it goes on to the next option. So it starts going to go through the different types of settings. So the first one is your time, how much you want your total treatment time to go for. It's preset as far as the ratio. For filling and then, or inflating and then deflating. And typically that's going to be a 3-to-1 ratio. So our total time right now, it's preset for 1 hour. And then you can go all the way up to 4 hours if you need to. But that's your time. And then if you hit mode 2 times, so once to set and then once to progress through the settings, you get your actual pressure. Now, depending on if we're doing an upper or a lower extremity, our pressure is going to be the same. Your pressure is going to end up being anywhere between 30 to 80 millimeters of mercury. For lower extremity, I think it's between 30 and 60, and then upper extremity is going to be between 40 and 80. If I'm correct, which I am. Surprise, surprise, no. So right now it's set for 60. Now your total pressure is going to be dependent on your patient's blood pressure, which we'll get into here in just a second. But so you would set whatever your amount of pressure you want. It's preset for 60. You can go up and down for whatever you want to. So you hit mode again, it sets that. If we hit mode again, it jumps to the next setting, which is total time. Now it says 6.8 hours. That is not the total treatment time. That just means that this machine has been run for a total of 6.8 hours. Now, why would that be important? Biggest reason is to make sure that your patient, because a lot of times they'll have a unit like this at home, to make sure that your patient is actually doing what they're supposed to be doing. So if they have had prescribed that they're supposed to be doing that sequential therapy for 3 hours a day, and you come back, say you tell them that, you check the machine and it's at like 6.8, you come back the next day and it says it's at like 7. Well, that's pretty obvious that they haven't done 3 hours of treatment. And so we would have to encourage, we document all that fun stuff, say patient didn't do what they were supposed to do. And then we would encourage our patient, say, hey, look, I can see if you've actually done your treatment. Not just in the fact that we're not seeing the results, but also I've got a little timer here that tells me whether or not you did it. So that's why we have that total timer, is just to tell if the patient's actually, primarily to tell if the patient's actually done it. So those are all of our settings. We hit mode again, it beeps at us, it gives us a green light, and that means, hey, we're good to go. So we get our patient hooked up, and then as soon as we do, we hit the start. So on the front, there are these 2 little slots, little cartridges, and you have a little connector like this on the end of the hoses that are attached to the sleeve, or the compression sleeve that we're going to use. So you'll put that into this little cartridge spot, and that's where all the air is going to go in and out of, essentially, is what happens there. So we've got it all set up. Let's set up our patient here. Again, I've enlisted my lovely wife. So a couple things. First, we already kind of talked about one. Why would we use compression pumps? Primarily, it's to modify the circulation somehow. Like I said, maybe they don't have, well, they're not going to have the venous flow that we want, that venous return. And so we're using this compression pump to help kind of simulate that muscle pump as much as possible. Typically, you're not going to use something like this for scar tissue, like for burns or anything like that. Those, they're going to just need a continued static compression, if you will. And so that's when you get into the pressure garments and short stretch and things like that. These are best and commonly used in conjunction with that static compression of a wrap. So the wraps you'll typically change daily, if not more frequently, especially if you've got lymphedema going on, just because of the fact that you get that oozing and everything else like that. And so it dampens the dressing and everything, and so you have to clean that up and put fresh bandages on there. But they'll be typically using that static compression throughout the majority of the day, possibly even through the night if it's called for, and then you'll use this to do more of an muscle pump like I mentioned. So first thing, as always with modalities, we're going to check a patient's sensation, and we're going to check just superficial sensation and deep sensation, because the fact that pressure is going to cause some of those deep sensation receptors to get fired and send some signals. And so we want to do both of those by giving some pressure to their the muscle belly or things like that if it's appropriate, and making sure that they can feel it. Okay, and then monitoring their blood pressure. Like I mentioned, you always want to take your patient's blood pressure before, during, if possible, and then after treatment of compression pumps. And then you're going to measure the limb circumference. So in videos or in lecture, you will have most likely talked about how to measure some of those slides, and there are some videos associated with how to measure circumference, and so we're not going to go over that as of right now. And then you got to determine if you just want to use straight intermittent or if you want to use that sequential cuff. Typically sequential is preferred, just because the fact that pressure does go from distal to proximal. In fact, when you're using that sequential, that distal, say like with this machine, we're set up at 60 mmHg, that most distal bladder will fill up to the full 60, and then the next will actually be slightly below that, so it'll end up being like 55, 57, somewhere around there, and then slightly below, and then slightly below. So the majority of our pressure is going to be distal. So we're just trying to push it all more proximal. Already mentioned some of the parameters, so usually a 3-to-1 ratio as far as our inflation and our deflation time. Pressure range, like I kind of already talked about, you have that range between upper and lower extremity of 30 to 80 mmHg. Regardless of what you're doing, you're never going to go above the patient's diastolic number. Okay, so that second number that we get with that blood pressure, we never want to go above that, because if we do, then we're not allowing actually for that blood pressure to move, or excuse me, that blood and the liquids to move. So we want to make sure that we're below that. Treatment time can be 1 to 4 hours, like I mentioned. Frequency can be anywhere from 3 times a week to maybe even 4 times a day. So depending on the severity and what is called for, they may be doing this quite often. So make sure that, again, you know how to use the machine so you can tell if they're actually using it as much as they should, and make sure that you instruct your patient on how to use it appropriately. So clinical guidelines, limited research, like I already mentioned, hence the fact that there's some controversy surrounding it as far as lymphedema use goes. Edema, DVT, venous stasis ulcer, all of those could be reasons. Now, when I say DVT, it's to hopefully prevent a DVT, not to dislodge a DVT. And then, I think all of the other information you pretty much get in the lecture. Again, your inflation, deflation, 3-to-1. Usually your inflation will take anywhere from 80 to 100 seconds. Your deflation will take anywhere from 25 to 35 if we're talking edema or DVT avoidance. Pressure we already talked about. Time, residual limb. Now we can use it if somebody has had an amputation, and if they have a residual limb. If we're using it for that purpose, then our ratio actually goes up. So we have a 4-to-1. So our inflation takes a little bit longer than our deflation does, it takes less time. So our inflation will be anywhere from 40 to 60 seconds, and our deflation will be 10 to 15 seconds. And I already talked about all the rest. So let's set our patient up. We've got our little connector that's going to go right in the front of the machine. And then, like I said, this is for an upper extremity. With this, sometimes you'll have, we always called it something funny. And honestly, it wouldn't be me if I didn't tell you this. We called it an arm condom. But it was essentially just a really thin mesh, like almost a cheesecloth that you would slide over the patient's arm or limb. And this helps with the comfort of the patient because these things can get pretty sweaty. Plus, it decreases the possibility of this rubbing on them and causing any skin tears or anything. So you got this cheesecloth that they pull over their arm or their limb just for comfort. But so we would slide that in there. Ideally, you would want to have the arm or the limb a little bit elevated if you can. We've already got it all set up, so we're going to hit start. You guys won't be able to really tell what's going on, but our pressure's building up, and it's kind of building up right now throughout all of it. But then when we get close to that 60 mark, which is what we set it for, then the first bladder, this first chamber, will really start to fill up. So throughout the whole thing, it's starting to, air is getting pushed throughout it, throughout each chamber, and so they're all kind of filling up at the same time. But there's definitely going to be more. So right now, we're starting to feel more pressure, more air being filled into that first chamber. And then once that one hits 60, like I mentioned before, then it'll go to the second chamber, and then the third and the fourth, so on and so forth, however many chambers they have. It's taking its sweet time. You guys probably can't see, and I don't know if I can get close enough. Yeah, no, not gonna. Can I get an angle? Nope, I can't get an angle that's gonna be good. Maybe I can just do this. There we go. Okay. Hey, look at that. Oh, we just went up to. Oh, whoa, we really jumped. Okay. We're jumping all over the place. But you can see now that the entire sleeve is pretty full. Okay, so chamber 1, we just hit 60. Okay. And then there's chamber 2. And you'll notice, so it says 56. Hopefully that actually says 56 and it's not like 20 backwards 6 for you guys. It probably is. But it says 56 and chamber 2. So here pretty soon it's going to, there, went to chamber 3. Chamber 3 is going to bump up to just above 50, 52. Which that actually looks like 52. And then here comes chamber 4. Bumps up to 47. And that was our last chamber. And then it's going to hold that pressure for a few seconds. And then it's going to release. Boom. Okay, so now there's our deflation time. And deflates. Doesn't go all the way down. It just deflates enough that the patient feels some relief in that pressure, and then it'll go back up. Okay, so now we're back at 1. It just hit 60. We're going to jump to 2 here in just a second. Dunk. There it goes. Okay, so we'll just continue like this throughout the entire treatment. If it's an hour or if it's 4 hours, and the patient would just sit there. And again, hopefully we'll get those positive effects of trying to simulate that muscle pump as much as possible. Okay, so that is compression pumps on this video. On the next video, or possibly the one that you've already watched, we're going to talk real quickly about compression wraps.